Have you ever wondered what happens in the body before a stroke strikes? Most people think it comes out of nowhere, suddenly without warning. But the truth is, in many cases, the body does send signals. We just don't recognize them. In today's episode, I'll show you what these early symptoms really look like, the subtle changes that can appear a few days or even weeks before a stroke. Because understanding these signals can literally save a life, yours or someone you love. I don't think it's an exaggeration to say that recognizing these warning signs and reacting quickly can truly make the difference between life and death. I believe that if each of us had this knowledge, we could prevent many tragedies and much unnecessary suffering in the future after a stroke, such as living with physical or cognitive impairment, something that I think we all fear. And here's something that might surprise you. There are simple, science-backed ways to lower your risk of stroke by up to 97%. Before we start, please remember that the information shared in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor or healthcare provider before making any changes to your health routine. Let's start by explaining where a stroke comes from and what it actually is. A stroke occurs when there is a sudden disruption of blood flow to the brain, which unfortunately leads to the death of brain cells. In the vast majority of cases, about 80%, the cause of a stroke is the blockage of a blood vessel in the brain by a blood clot that forms in the carotid artery or travels there from the heart. This is known as an ischemic stroke. The most common cause of this type of stroke is atherosclerosis, which develops as a result of harmful lifestyle habits. Primarily poor diet, but also a lack of physical activity, smoking, uncontrolled high blood pressure, diabetes, and elevated cholesterol levels in the blood. The second type of stroke is a hemorrhagic stroke, which occurs when a blood vessel ruptures and blood leaks into the brain tissue. This leads to increased pressure inside the skull and compression of the brain. This type of stroke accounts for about 20% of all cases and is often associated with uncontrolled high blood pressure, brain aneurysms, or head injuries. Now that we understand what a stroke is and what causes it, let's move on to the main topic of today's episode, the warning signs of a stroke. I want to emphasize once again that the symptoms I'm about to describe may, although not always, appear several days or even weeks before an actual stroke. That's why recognizing them early and consulting a doctor can significantly increase your chances of avoiding a stroke and maintaining your health. So what symptoms can alert us to the risk of a stroke? First of all, there is what's called a sentinel headache, a type of headache you've never experienced before, or an unusually severe headache that appears roughly 7 days before a stroke. In a study involving 550 people who had an ischemic stroke, it was found that 15% of participants experienced this completely new kind of headache that persisted throughout the entire week before the stroke occurred. Similar results were reported in an earlier study conducted with 120 stroke patients, where 18% of them noticed the same type of sentinel headache. According to patients' own descriptions, a headache that warns of an upcoming stroke often resembles a migraine, but it can also feel like a tension-type headache, or what doctors call a thunderclap headache. Next, what other concerning symptoms can signal an upcoming stroke? These may include issues like difficulty concentrating, confusion, or a feeling of mental fog. These symptoms often result from what's known as small vessel disease, a condition in which the tiny blood vessels in the brain become stiff and damaged, reducing the brain's supply of oxygen and blood. What's very important to note is that small vessel disease is estimated to account for about 30% of all ischemic strokes. The concentration problems I mentioned, such as frequently losing track of a conversation or suddenly forgetting what you were talking about, can also be signs of what's called a mini-stroke or transient ischemic attack, TIA. Let me stress this again. This is critically important. A mini-stroke happens when a blood vessel in the brain becomes temporarily blocked or when blood flow to the brain drops significantly for just a few minutes. During that time, the brain doesn't get enough oxygen and nutrients, which can cause short-term neurological symptoms that should never be ignored. Dear viewers, this kind of partial loss of blood flow to a part of the brain produces symptoms very similar to those of a full stroke. However, in this case, the symptoms usually disappear within a few or several minutes, and almost always within 24 hours. This means we're talking about the sudden onset and relatively quick resolution of symptoms such as numbness in the legs, arms, or face, typically on one side of the body, difficulty speaking, trouble finding words or reading, problems with calculation, vision disturbances in one or both eyes, severe headache or dizziness, difficulty maintaining balance, as well as the concentration problems mentioned earlier. Of course, the specific symptoms depend on which area of the brain was affected by the temporary lack of blood flow. Sometimes several warning signs may appear together, while in other cases, only one may show up. So what am I getting at? We should never ignore these kinds of symptoms, even if they last only a short while and then completely disappear. Warning signs of a stroke, including the symptoms of a mini-stroke, should always be discussed with a doctor because they are a clear signal that blood flow in the brain is being disrupted. It's estimated that about 1/3 of people who experience a mini-stroke will go on to have a full ischemic stroke in the future. That's why it's so important to stay alert and act quickly. Starting treatment early, for example, with antiplatelet or anticoagulant medications, and making healthy lifestyle changes are highly effective ways to lower this risk. According to recent scientific evidence, the risk of a stroke among patients hospitalized after a mini-stroke within the next 90 days is less than 3%. In other words, early intervention can reduce the risk of a major stroke by 97%. That truly makes it a life-saving action. That's why it's so important not to ignore the symptoms of a stroke, even if they only last a few minutes, and to contact a doctor as soon as possible, or if necessary, call an ambulance right away. Before we finish, I'd like to mention something very useful: the FAST test. It's a simple method that helps quickly recognize the signs of a stroke. FAST is easy to remember and even easier to perform. It's an acronym formed from the word itself. The first letter F stands for face. Ask the person you suspect might be having a stroke to smile. If one side of the mouth droops, it's likely a sign of a stroke. Next, A stands for arms. Ask the person to raise both arms. If one arm appears weaker or starts to drift downward, and you can clearly see it dropping, that's another strong sign of a possible stroke. Next is the letter S, which stands for speech. Ask the person to repeat a simple sentence. If their speech sounds slurred, unclear, or if they are unable to repeat the sentence or seem not to understand what is being said, call emergency services immediately. And this brings us to the last letter, T for time. If you notice any of these symptoms, don't wait or try to figure out what's happening. Call emergency services right away. In the case of a stroke, every minute truly counts. Even if the symptoms disappear while you're waiting for help or during the call, that doesn't change anything. It could have been a mini-stroke, which, as we already know, also requires medical attention because it may be a warning sign of a full stroke in the near future. And let me remind you once again, if action is taken during a mini-stroke and treatment with antiplatelet or anticoagulant medication is started, the risk of developing a full stroke can be reduced by as much as 97%. If you'd like to learn how to protect yourself from a stroke, I warmly encourage you to subscribe to this channel. Very soon, there will be an episode dedicated entirely to this topic, as well as many other videos covering important health issues. Thank you for spending this time with me, and as always, I invite you to join me in the next episode. See you soon. Take care and stay healthy.